Last week, that number was 179.
On a balmy Thanksgiving weekday, the threat of flu season might seem far-flung, but doctors' offices and hospitals across Dallas are seeing it firsthand.
This is actually the earliest we've seen it in several years.
Dr. Huang is Dallas County's Health and Human Services Director. He says more than 10% of flu tests are coming back positive in the past couple weeks. It didn't get that high until the third week of December last year.
We don't know how that will play out for the rest of the season, but it's certainly concerning.
It's not just Dallas, and it's not just the flu. Last Monday, Cook Children's in Fort Worth saw 567 patients in the ER. That's nearly double the typical patients. Officials attributed the high number to the first wave of flu, but also unrelated respiratory illnesses. The increase in illnesses comes as many families are preparing to travel for Thanksgiving or visit family locally.
It is a tough call because we all want to see friends and family, right?
Dr. Tanya Martinez is a pediatric pulmonologist at Children's in Dallas. She says parents should be extra careful with children under 6 months or with other health conditions that put them at risk.
If you have some of these, one of these children that are higher risk, you may want to be a little more vigilant about exposing them and asking your family members in a really nice way whether they're sick.
But Martinez says it's also important to not unnecessarily bring your child to an ER or urgent care. They could be exposed to something more serious if they only have a cold.
If your child just has a cold or has a mild fever but is otherwise looking okay, you may want to just watch them. So you're exposing them to other viruses and other sick patients.
Dallas County health officials have put out a memo to medical providers. They are urging clinicians to remind their patients to get a flu shot. While it will not kick in time for Thanksgiving, it will mean that folks are better protected in time for Christmas.